Breast cancer is the second most common cancer among women in the United States, and October is Breast Cancer Awareness Month, the perfect time to remind all women about the importance of self-breast checks and exams. So here now is Dr. Laura Barkey, breast radiologist with Envision Sally Jobe at Health One. And Dr. Barkey, let's start with screenings. When should women be getting mammograms?
So I get this question all the time, and really the bottom line is women should get screened every year starting at 40. That is the basic answer that almost everybody falls into. There are some women that may need to screen earlier than age 40, and that's based on their family history or personal history. So it's really important to get assessed and make sure you know when should you start. But really the simple answer is start at 40 every year.
Great. And we know a lot of women fear having mammograms done. What would you say to convince them to get tested and just why it's so important?
So screening mammography began in the 1980s. And when it became widespread in the U.S., we found that there was a reduction in mortality from breast cancer of about 38%. And that's a big deal. We don't have many tests that we can see something like that as being such a success. So that's why screening mammography is recommended every year, and it has shown that there's actual proof that it does something and it saves lives. So while it is sometimes anxiety provoking to go get a test because you just don't know the results, it is important to do so because we have data to show that you do get a reduction in mortality. And I should also mention that, you know, most of the women that come in for their screening mammogram are told that everything looks fine. So about 90% of patients are reassured that there's nothing abnormal in their mammogram. So I think that, you know, when you weigh those two things, it really proves that this is a study that should be done and it saves lives.
Right, it's just so important. And we know that some symptoms can be caught early just by being proactive. So what types of things should women be thinking about or keeping an eye out for?
Yes, it's really important to know your breasts. Do a monthly self-breast exam. Ensure that there are no lumps or bumps that are new. If you do have any new findings, it is important to come in and get a diagnostic mammogram where we take a very specific look at that area that you're questioning. And also, we will do an ultrasound of that particular area. I don't want to discourage you from seeing your doctor because an annual exam with your doctor is also very important. They can find things too that you may not be able to find on your breast exam. Also, if you notice any changes in your breast, such as skin changes, any nipple changes or nipple retraction, any nipple discharge, those are the kind of things that we want to take a closer look. And we will do so to reassure you and also to determine if there's anything there that needs to be checked even further. So it's really important to differentiate someone with a clinical finding versus someone who doesn't have a clinical finding and would fall into more of a screening population.
Right.
So come on in, and if you have any of those symptoms, please let us know. We will check them thoroughly.
Great, that's great advice. And does family history put someone at a higher risk of breast cancer?
Yes, so there are some women that may need to start screening earlier than age 40 based on that family history. There are also women that may need to add other tools to a screening mammogram because of their risk factors. So when you come into Envision Sally Jobe, we do a full risk assessment and we determine which category you fall into. We will also give you information about breast density. And in 2017, the state of Colorado passed legislation that we need to inform women what their breast density is because it does elevate their risk. It also may make it a little bit more difficult to read their screening mammogram, so other tools like screening breast ultrasound or MRI may be added because of that breast density. And so I also want to mention that genetic testing is sometimes important, and when someone has a risk factor such as a family history of a certain mutation such as BRCA1 or 2, you may need to start screening even earlier than age 40, as early as age 25. So getting risk assessed before you even start coming in for your mammogram is certainly recommended.
Absolutely. Is there anything else that we haven't talked about specifically with breast cancer that you want our viewers to know about?
Yes, I want to make sure your viewers understand that coming every year is really important. And we understand that things happen in life, and that particularly with this last year and the pandemic, we did not see everybody this past year. We are starting to see many people come in now, and we're very happy that they are, because we know that this is a test that can save their life. So please don't hesitate, and don't feel bad if you haven't come in. We will welcome you with open arms and help you get screened and make sure that there isn't something there that we need to take care of.
All right. Well, thank you so much, Dr. Barkey, for joining us today. We really appreciate it. This is just such an important topic, so thank you.
Thank you for your time, and we'll see you all in our centers.
Sounds great. And we have much more information and breast cancer resources at cbsdenver.com.